Hello, everyone. We're back here on The Girls on SSP TV with my mom and Lori via Zoom. Hi, girls.
Hi.
I think we're doing a pretty good job from home. What do you think?
Not bad. It's a little easier, I think. I don't feel as rushed because I could go from either my office right to the computer or just stay at the office and do it, whatever. For me, it's a little easier.
Yeah. About the one thing about Zoom, you know, a lot of people, everyone you talk to now, everyone knows what Zoom is. And I don't know, what are some pros and cons for you? I know what my pros would be.
Oh, gosh.
Are you going to start with me?
Go ahead. Let's hear it.
Okay, so first of all, Zoom for me is great. I mean, I'm right here, I have all access, but because I live in a neighborhood that's very active, at any time there's all kind of lawnmowers running or the doorbell's ringing or the dog is going to bark because, of course, the UPS truck goes by and for some reason he hates the UPS truck. So we have that going on, and I have to have a conscientious animal wrangler here who sometimes is on the phone and forgets that I have something going on, and when we're hearing him speaking in the background, you know who that is.
So that's your con, that there's like interference in the background. That's what most people say. They like the convenience because you do save time, right? I love that you really don't have to worry too much about what you're wearing other than the shirt. And if it's a little snug, you just move the camera a little bit like this. Soon if COVID continues, I'm going to be like this. You won't even see my face, right? I'm just going to be blowing up. Lori?
Well, for me, for work, it's wonderful because it's a way to keep my clients connected. And I have more clients who are able to participate via Zoom than even came in person because we have such a large coverage area. So, you know, for us, it's been really an asset to us. But I have to agree, the distractions when I'm on meetings and when we're doing the shows, the distractions in the background, the extra noise. At the office, the telephone always rings and I'll be on a meeting and I'm trying to hit mute and grab the phone and turn the camera off so I can answer the phone. So yeah, it has challenges, but for the most part, it really is good for us.
Well, and also we've been able to speak with people who couldn't normally make it to the studio. So that's the biggest advantage, is that we're reaching out to all other states too, where they don't require traveling because, you know, we're going to be reaching Hawaii and California, Texas, and all those good places too. So yeah, it's pretty cool.
Too bad you can't feel the weather though through Zoom, because that'd be pretty good. Hey, let me check out Hawaii. Just hold on 1 second and you just be there in the sunshine and in all of the nice weather.
Well, I've already put a request in that I think that we can maybe do a show in Hawaii. I think we shouldn't have to be doing the Zoom. I think we should Zoom on over. And I think I have the finances almost squeezed out of the head office.
She's got a little pool, huh? Lori, what do you think?
I'm in. Let's go.
All right. Well, today's show, March is Colon Cancer Awareness Month, and we are going to have a doctor on with us, the colon and rectal surgeon, and he is from Lehigh Valley Hospital, the network here. So he's going to join us. The doctor is going to join us on the show to talk about what we should look for, the signs, the symptoms to keep us all safe during March, again, Colon Cancer Awareness Month, and we're going to hit on that. That's the topic on our show today. So stay with us. We'll be right back here on The Girls. Hi, everyone, and welcome to The Girls here on SSP TV. We hope you are enjoying us via Zoom this season. We are happy to be talking about a very important subject. March is Colon Cancer Awareness Month, and we have a Lehigh Valley Health Network out of Hazleton. We have Dr. Joshua Nochumson with us to discuss the signs, the symptoms, and I know my mom's going to jump right in because she's a registered nurse, so she knows a lot about this subject as well. So, Doctor, thanks for joining us here on The Girls.
Thank you very much for having me.
Yes, Doctor, as Janine said, I'm going to jump right in there because healthcare is one of the top priorities I know in our family because of my being a nurse and because of all of the education we've been provided, not only by Lehigh Valley, but a lot of other avenues of communication. It's so great that you took some time to try to educate the public on this. Colorectal cancer, as I understand it, I had an uncle who had colorectal cancer back in 1975. And at that point, if you heard you had colorectal cancer, it was almost like a death sentence. So I know that a lot of it has come with the treatments, however, has come a long way. So if you could touch on some of the points for us as to what kind of screenings and things that you have, what you offer to people, what colorectal cancer, maybe signs and symptoms and other things that they could do to find out if they have it.
Well, absolutely. Yeah. And since 1975, what's nice about colon cancer is that it's been decreasing in incidence ever since the 1980s, when screening for colon cancer has been much more widely implemented. So by being proactive and being able to detect colon cancer before it forms or at a very early stage has been really a huge benefit to the population in this country and lowering the incidence really over the past 30 or 40 years. And of course, everyone knows that predominantly the screening modality in this country for a long time has been colonoscopies, and we can touch on that. But there are other screening methods because there are people who, for whatever reason, will not go through with the colonoscopy or are not told that maybe that's something that could be useful to them, and then just ignore getting screened. And then by the time they come down with symptoms, unfortunately, that often portends a more advanced stage of the disease, which is more challenging to treat. So the take-home message is colon cancer is, number one, preventable, but also extremely treatable if it's detected and identified at an early stage. And that's the goal. And that's why March, being Colon Cancer Awareness Month, is so important to proselytize and get the word out to people who had been hesitant for themselves, perhaps to get screened, or perhaps to influence family members or friends who have yet to be screened, that this is something very important for them. And we're here to assist in that endeavor.
Let's talk about the colonoscopies. I know firsthand about colonoscopies. I've been getting colonoscopies since I'm 2 years old, with an issue that I had when I was younger. But boy, oh boy, has the test gotten a lot easier. In 1976, Mom, was it 77? They used to keep you awake during the colonoscopy test, and now it's just, I mean, I know the prep, it's maybe a reason why people put it off, because the prep's a little struggle for some, but it definitely has come a long way from, I've had several awake, and it's not a fun experience to have at all.
That's true. Although I do mention to patients, because some people do have inhibitions about being put under anesthesia. So there are a percentage of patients who prefer to have it awake, if you can believe it.
Right.
And it can be, as you're aware, it can be done awake. But the vast majority nowadays get put under anesthesia. And so the colonoscopy itself, by the time you're showing up to the test, you've done the hard part. The colonoscopy itself is very easy. You get a nice 20-30 minute rest or sleep, and then you wake up and it's all done. But
Hell no, put me right out, Doc.
Right,
I don't want to talk about being awake. I did that before and it wasn't too fun to do. But I know what you're saying.
Let me correct you 1 second there, Janine. You were 4 years old and you had barium enema, and she had that with well, I was in the room with her and they were doing the x-rays and whatever. So she was very, very cooperative, and that was very difficult even for an adult to do. And that's what you remember as being awake. But your colonoscopies have all been under the twilight anesthesia. Yeah.
Well, there's still, I think that's why people, when you talk about of the awareness of people going and getting their colonoscopy, to make the time to go, it's not something that you look forward to, like, let me book this because this is going to be so enjoyable. But like you're saying, the screening and getting the test ahead of time is really the way that you could keep your colon healthy, right? To make sure that it's staying healthy.
Of course, yeah, that's true. And so the idea with the colonoscopy, which in this country has generally been the gold standard for screening, it allows you to look directly into the colon and identify little what we call lumps or bumps, which we term polyps. And polyps are the precursors, or can be the precursors to cancer. And it can take, sometimes between 7 to 10 years for a colon to go from a normal portion of the colon to developing a polyp, and then from that polyp turning into a cancer. So that factors into some of the time, guidelines in terms of when people should be getting their colonoscopies and the intervals between them. But if we can do a colonoscopy and we can find polyps and remove them, then we've done a service to that patient, because we've likely prevented them from being able to get colon cancer, which is unique because many other cancers, unfortunately, we don't have that ability to prevent. And colon cancer is a cancer we do have that ability to prevent. And that's why certain screenings or societies in this country have recommended certain guidelines in terms of when people should start to get screened, who should be screened, and so forth.
Doctor, is there a particular series of symptoms or a certain age that somebody should be before they would come to the doctor for this type of issue? I've also had many colonoscopies, lots of different stuff going on, and I always call right away, make my appointment, and go get my colonoscopy. But for people watching, they might not know when it's time to reach to their physician to, maybe schedule this screening.
Right. So that's an important point, because a lot of patients will say, well, I don't have any symptoms. I don't have any pain or bleeding. Why? I don't have any family history of colon cancer. Why should I have to get this test? It's not for me. The reality is the vast majority of colon cancer, 75%, are found in people who have no family history of colon cancer. So we call those sporadic cancers. And any random or average risk person has about a 4.5 to 5% lifetime risk of coming down with colon cancer. So that could be anyone. You're walking on the street, you find someone has a 5% lifetime risk of that. So because of that, and because the risk of colon cancer increases with increasing age, the guidelines historically have been to start screening just your average risk person. This is someone with no symptoms, no family history of colon cancer, starting at age 50. Now, some societies now are actually changing that guideline. In fact, the American Cancer Society a few years ago changed that to recommend screening start at age 45. And the reason for that is, while I've mentioned that colon cancer overall has been going down in incidence since the 1980s, over the last 10, 20 years, it's actually been increasing slightly, maybe 1% per year in the population younger than 50, which is very concerning to us. So because of that, some of the societies, the medical societies that create screening guidelines have started to recommend 45 as being the age at which screening should start for colon cancer.
Well, Doc, does colon cancer, is it more popular for men, women? Does it discriminate against a certain gender or race?
Generally not. Generally, it's found almost equivalently in both sexes. Men may have a slightly higher incidence, a negligibly higher incidence, but that may be attributable to the fact that women, if you factor in that they tend to live a little bit longer, kind of even out for that.
Very good. We're going to pick up our discussion when we come back. Again, March is Colon Cancer Awareness Month, and we're with Lehigh Valley Health Network with Dr. Joshua here on The Girls. And when we come back, we will pick up our topic on Colon Cancer Awareness Month.
Welcome back to The Girls. We have a very important discussion going on about colorectal cancer. We are in March, which is Colorectal Cancer Awareness Month. We are with a representative from Lehigh Valley Health Network. We have Dr. Josh with us. We've been discussing some of the signs and symptoms and some of the preventable tests that can be done for colorectal cancer. We discussed colonoscopy. There is another test, though. Is there just a little prep kit or something too, Doctor, if you want to discuss some other tests and things that are done or little screenings that can be done to detect colorectal cancer?
Yes, that's true. There are some stool-based screening tests. Historically, there was a test that would check for the presence of occult blood in the stool. That test has actually been improved slightly because the original test wouldn't be able to discriminate, was that blood coming from the colon, which is the lower intestines. Could that blood also be coming from the stomach or upper part of the GI tract? So this newer stool test is called the FIT test, FIT, and that can detect human blood in the stools coming from the lower GI tract. And that you do over a sequence of stool samples to increase sensitivity. Another test that's been around now for several years, this is advertised fairly extensively. You may have seen it, it's called Cologuard, and that incorporates the component of that FIT test looking for blood in the stool, as well as it can detect some abnormal DNA that can be present in the stool from possible tumor cells in the colon where the DNA or the cells have sloughed off into the stool and can be picked up from this test. So that's Cologuard. The advantage of these tests is they can be done at home. They don't require a bowel preparation that you would have to take for a colonoscopy. And they get sent back to a laboratory study for a laboratory for analysis. There are some downsides. Obviously, if the test comes back positive, then that would need to be followed up with a colonoscopy. At least for the Cologuard, there's also some concern about a false positive rate, meaning about 13 to 15% of the tests come back positive abnormally, meaning there's a normal colon, nothing to be concerned about, and yet the test gives you a positive result. And of course, that creates a lot of anxiety and worry in patients. And then they have to subsequently wait to get their colonoscopy to see what's going on. Also, there's about an 8% false negative rate, which is more concerning. So it misses maybe 8% of significant lesions in the colon. Having said that, we say that the best test for colon cancer is the test that gets done. So if it's a choice for people between doing nothing and doing one of these stool-based tests, better to do one of these stool-based tests for sure.
Is there a way to keep your colon healthy? Like what your diet, exercise?
Yeah, so colon cancer, there's several risk factors for this now. And we know that colon cancer is slightly more likely in people who are obese, people who have type 2 diabetes, people with very sedentary lifestyle. Diet measures can play a role too. People who eat a lot of animal fats or nitrates in processed foods in their diet have a higher risk of developing colon cancer, as do people who smoke, and this is true for a variety of other cancers, and abuse alcohol. So there are modifiable risk factors that can improve one's risk, lower one's risk of colon cancer. So we aggressively recommend, making sure your weight is within the normal body mass index, moderate amounts of alcohol, smoking cessation, if that can be done, and higher fiber, lower fat diets, or even plant-based diets can be very effective in lowering one's risk.
You talked about if someone in your family had colon cancer, if you're not 50 years old where you're scheduled, you should be scheduling to have your colonoscopy, but you have a family member who had colon cancer, should you talk to your doctor, and are you likely to be able to have the colonoscopy before the age of 50?
Yes, absolutely. And in fact, if your let's say you had a first-degree family member, or let's say a parent who had colon cancer at a relatively young age, we recommend screening the offspring, the child of that parent, typically about 10 years sooner than the age at which the parent got diagnosed. So if the parent developed colon cancer at age 50 or 55, then 40 or 45, something like that would be recommended.
Doctor, I was recently just at my physician's office, and there was a poster on the back of the door, and I was looking at it because it talked about colon cancer. And I thought it was interesting that they said 90% when it's caught early enough is actually a completely curable cancer. Is that correct? That it's curable?
That's correct. So early cancer will generally be termed what we call a stage 1 cancer. And yes, survival rates for stage 1 cancer are well into the 90 to 95%. So that speaks to the importance of trying to find these cancers, prevent them if we can find these polyps and remove them. But if we find the cancers at an early stage, they're much more effectively treated than a stage 4 cancer where it's spread to other parts of the body. That may only have a 15% survival associated with it.
And doctor, you mentioned if you find something, you don't have colon cancer, but maybe you had a colonoscopy and they remove polyps that were benign. Does that go on your record? Like say your parents or a relative had polyps, but they were benign. Does that still mean you should get checked that 10 years earlier if you're the sibling or if you're the child?
Yes.
Okay.
A first degree relative with colon polyps, parents or sibling with polyps does increase your risk of forming polyps as well. And so, yes, that would factor into when you should be recommended to get your initial or baseline screening colonoscopy. And in that, I should say in that case, that would be a situation where a family member has had polyps or cancer. You would not be a candidate for a stool-based test like the Cologuard or that FIT test. Patients who have a first-degree relative with polyps or history of cancer should undergo a colonoscopy and skip any stool-based screening test.
And doctor, how often should the colonoscopy be performed on a person who is a high risk?
Well, for a high-risk person, it depends on exactly what the risks are. Some people are high risk because they have underlying inflammatory conditions of their intestines. So we call that inflammatory bowel disease. Oftentimes, those patients would be screened every 1 to 2 years. But for someone with a family history of colon polyps or cancer would get an early baseline colonoscopy. If that looks normal, then they could the normal recommendation would be to wait about 7 to 10 years. But in a person with a family history of colon cancer or polyps with a normal baseline colonoscopy, we would probably wait 3 to 5 years to rescreen them.
Doc, could children get colon cancer?
Well, they can. There are some familial genetic syndromes. These are not super common, but these are polyp-forming syndromes in certain and genetic cohorts of families where they form thousands of polyps in their colon. And people who have this genetic condition in their family are recommended to go through a prophylactic colon resection, usually just after finishing high school would be the normal recommendation because their chance of developing cancer of the colon is extremely high. But it's not very common for your average person or family.
Very good. So we're running out of time on the program, but we wanted to let people know how they can get more information on colon cancer. If they wanted to schedule a screening, do they just check with their healthcare provider?
Yeah, so I would go to your primary care physician first and foremost and discuss, your options. If you're an average risk and you want a stool-based test, your primary doctor can order that or can refer for a colonoscopy. And now, if you're an average risk patient with no significant medical issues, now you can be fed into what's called a fast track program where you don't even have to see the endoscopist before the test. Your primary doctor can just set this up and you would show up the day of the exam for your procedure. You don't have to have another appointment to meet with the gastroenterologist or the colorectal surgeon.
Thank you, doctor. You've brought so much great information to us today. It certainly has streamlined a lot of the questions that a lot of people have, and I hope that we can save some lives out there by people having early screenings and prevention. If they have any more questions, I'm sure that they can go to the Lehigh Valley Health Network site and they could reach out to their doctors. They could also ask some questions. And I know you have seminars as well. So we try to keep people informed on our local station on the news and try to highlight what's going on. So thank you very much for taking time. We appreciate it. We hope everybody out there enjoyed the show. And I guess we'll see you next time on The Girls. Stay healthy.